Have you ever felt your forehead burning up, your body aching, and a sense of fatigue washing over you? That's your body's way of telling you something's off. You have a fever. Fever, while uncomfortable, is actually a natural defense mechanism, a sign that your immune system is battling an intruder, most commonly an infection. When this happens, our bodies release chemicals that turn up the heat, creating an environment that's less hospitable to these invaders. While a fever is generally a normal response to illness, sometimes it can climb a little too high for comfort. That's where antipyretic drugs, commonly known as fever reducers, come into play. These medications provide relief from the unpleasant symptoms of fever, helping us feel better while our bodies do the important work of fighting off whatever's ailing us. Antipyretics are a group of medications specifically designed to lower body temperature when a fever strikes. They work independently of the underlying cause of the fever, meaning they don't directly address the infection or illness itself. Instead, they target the mechanisms in our brain responsible for regulating body temperature. Some of the most widely used antipyretics are familiar names found in medicine cabinets around the world. Paracetamol, also known as acetaminophen, is a widely available medication, often the first line of defense against fever and pain for both children and adults. Ibuprofen, another common over-the-counter option, is known for its anti-inflammatory properties, along with its fever-reducing effects. And then there's aspirin, which, while effective in reducing fever, is not typically recommended for children due to the risk of a rare but serious condition called Reyes syndrome. To understand how antipyretics work, we need to delve into the intricate workings of our bodies. The control center for our body temperature resides in the brain's hypothalamus. When our immune system detects an infection, it releases substances called pyrogens, which in turn trigger the production of prostaglandins in the hypothalamus. Prostaglandins are like chemical messengers that tell the hypothalamus to raise the body's temperature set point, resulting in a fever. Antipyretic medications work by blocking the production of these prostaglandins, effectively turning down the thermostat in the hypothalamus and allowing the body to cool down. Section 4. Using antipyretics wisely, when and how. While antipyretics are generally safe and effective, it's important to use them judiciously. A slightly elevated temperature is a normal part of the body's immune response and doesn't always require medication. It's often more beneficial to allow the fever to run its course, as it can help the body fight off infection more effectively. However, if a fever is causing significant discomfort, interfering with sleep, or reaching potentially dangerous levels, antipyretics can provide much-needed relief. It's crucial to follow dosage instructions carefully, as exceeding the recommended dose can lead to adverse effects. When in doubt, always consult with a healthcare professional to determine the appropriate course of action for you or your child. Section 5. Fever facts and myths. Separating truth from fiction. Fevers often spark anxiety, leading to a number of misconceptions. One common myth is that antipyretics cure the underlying illness. It's important to remember that these medications solely address the symptom of fever, not the root cause. Another myth suggests that all fevers are harmful and should be treated immediately. In reality, most fevers are self-limiting and beneficial to the immune response. Interestingly, did you know that a fever can actually enhance the body's ability to fight infection? The increased temperature creates an environment that's less hospitable to invading microbes, while simultaneously boosting the production of immune cells. In conclusion, understanding how antipyretics work and when to use them empowers us to make informed decisions about managing fevers. By using these medications responsibly and seeking guidance from healthcare professionals, we can navigate fevers safely and effectively.